Hello, everybody. Mark Rogers here. It's Talking Turning 65, and we're going to come at you again during this Medicare season. We are, couple of weeks in? We're at the last, my goodness, we're already nipping on November here. So it is exciting to be with you one more time. Lots of changes going on. We want to make sure that you are not surprised. And to have that help, I bring on Leith Dist. Leith, thanks for jumping on one more week.
Good morning. Hello. Good morning. Another week in the books.
Another week in the books. We keep seeing all the changes, don't we?
Yep.
It's a fun thing. And one of the things we love to do is, as we bring information to people as well, is introduce other agent advisors out in the field as well. Leith and I are doing that here in the Northwest. And so recently been able to meet up with good friend Selina. Selina is in the northeast corner of Oregon helping people. Can you hear me, Selina?
Yes, I can. In the very tip of Northeast Oregon, the end of the road.
End of the road. Beautiful country up there. Beautiful country. And what's so compelling about Selina, you tell us a little bit about this. You have been a nurse for many years, and you recently turned in and started getting into the Medicare realm of things to help people in this aspect. Is that correct?
Yes, Mark. I was in the nursing field for a little over 30 years and decided to have a pivot in my career. And as a nurse, I had seen patients who were not getting their medications and really choosing between food, utilities, or meds. And so I thought maybe this is a place I can make a difference. So here I am.
And so you've been real busy here last couple of weeks, right? There's a lot of changes going out in the Northeast Oregon area, true?
True. And so the Part D drug plans, they are really changing for our area. And people are not only seeing higher premiums, unlike a few other states, but the change in formularies is really hitting us hard.
And then you also had Medicare Advantage plans leave. Is that true up in that neck of the woods?
True. So we have one Advantage plan
Yeah.
for our area. However, they went non-commissionable at the rollout of open enrollment, of annual enrollment. We can actually guide people how to sign up for those, but agents are no longer able to do the enrollment.
Let's talk about that topic for just a second. Very important. Folks, this is happening where agents like ourselves have been helping people. We serve people throughout the year, and now more and more plans are going non-commissionable on these things. You're being left to make your own choices because us agents can't help, or they're not getting paid to help. And so it's we got to make a little living as well. And so Cecilia, you've been in this for a couple years, and so this is a new phenomenon happening, isn't it? With policies or the Part D plans and Medicare Advantage plans are not being commissionable. It's a big deal.
Yes. And so aside from just receiving payment from the companies for doing our job, I feel like the seniors are left on their own to try to manipulate all of these plans and decide what is best for them. And I think without a skilled agent, that's tough.
And can I jump in here for a minute, Mark?
Yeah, you bet.
The other thing that bothers me about that is that the insurance carriers will have an 800 number for somebody to call, and they may not go through all of the questions that are important for someone to make the decisions. They're just there to write the business for that company, and that's it. So that you call 800, you get an agent, they say, oh, this plan would be great for you. I don't know that they if they do take the time, I'd be surprised, but they're not going to take the time to refer them to somebody else or to another plan or another option. They're going to just write for that company. And it's just, to me, it's such a disservice to the retirees. It really is.
I can't agree more. I think it's so important to do a needs analysis on every client.
Right.
And they may come in with this preconceived notion that an Advantage plan's for them. But after further discussion, it clearly is not, because of their travels or their doctors are not within a reasonable drive. And so those are things that captive agents sometimes do not discuss.
Yeah.
All the little hidden things. We're just disclosing all the little hidden things that are behind the scenes. It's a lot of people don't understand what all the changes that are happening, but folks like Celia or Leith or myself, we're keeping abreast of it. And so it's good to have that relationship. My phone's been ringing with questions with my clients. I'm not necessarily taking a whole lot of new clients on. I help these ones. And that's the same thing that we're there to serve. We all have that service mode, and I think that's so important. I want to turn the corner real quickly and mention something. Leith and I were looking at comments from last week. Leith, you were talking about an ambulance ride you were taking here
Right.
some time
Right.
ago, and the thought process
Right.
that was in your head. And
Right.
you're making the comment as you're in the ambulance, where are we going? Is it going to be a network? Now tell us a little bit what we read on the comment so we can address that and have Selina help us as well.
Just a quick recap. I had the pleasure of taking the ambulance ride. And I was thinking at the time, as soon as I got on, it's like, oh, because I used to have a Med Advantage plan a couple years ago. And I was thinking, oh gosh, an plan. And then I went, oh gosh, no, I've got a Medicare Supplement plan. So they can take me anywhere they want. So our comment, the feedback we got from a viewer was, if you have a Med Advantage plan, you can still go to any hospital. That's correct. And we just wanted to correct that. If you have a Med Advantage plan and you're in the hospital and you're in the ambulance, they can take you to whatever hospital is the closest, whatever your needs are, what level the hospital is for your care, etc. If you're on a Med Advantage plan, the problem runs in that if the hospital you land at is not in network and you have to stay and be admitted, they can ask to transfer you if you're medically stationary and able to be transferred. If you choose not to, you would probably have out of network benefit. So your costs would be more. Does that make sense? Am I stating that correctly, Selena, since you're on the medical side?
Yes. So I tell my clients who are snowbirds that if you fall and you break your hip when you're in Yuma, you can go to the emergency room and you're not going to be billed out of network. But let's say the doctor recommends you have your hip repaired. That is an
Right.
elective surgery. And so if you're in Yuma and your other network's in Joseph, that's a long ride home unless you
Right.
want to pay 50% out of network if that is offered within your Advantage plan.
Yeah. Yeah.
That
Yeah.
is interesting.
Yeah. So the point I was trying to make was on the last video we had was that I didn't have to make that decision because I had a Medicare supplement plan. So as soon as my brain kicked in, as they're talking to me in the ambulance, it was like, oh, just take me anywhere. I don't care. Best hospital, just take me. I knew I had coverage. And so that was the gist of it, because we were talking about the Medicare supplement plans or the Medigap plans where you don't have those restrictions. So anyway,
Yeah,
that
it's good.
was just what we wanted to recap for,
Exactly.
for clarification.
For
Yeah.
clarification, it's all about,
Right.
listen, in retirement, it's all about how you feel. Do I have to have questions? Do I have to have unnecessary questions? These are things that, even in the ambulance, this is a big deal not to have to worry about this along the way. So let's move over to a hot news item that we're picking up here. It has to do with drugs, by the way. It has to do with drugs. And it's good news, actually. For some of us, it's going to be good news. Medicare drug, this is Money Talk News, and it's dated here October 31st. Medicare drug plans are changing for 2026. There's good news and bad news, but let's talk about the good news. This annual enrollment we're in it right now. We're beginning November. It's going to run through December 7th, so you really have to keep on it, double check. Been a big advocate for many years. Make sure you're checking your drug plan. If you're on a original Medicare or if you're on a Medicare supplement with a drug plan as well, make sure you check your individual drug plan. So this is what it's saying. Good news. If you're enrolled in original Medicare and you have a Part D, what they call standalone drug plans, you may see your monthly premium decrease in 2026. Now, I want to stop for just a moment and say this is that you may not see that if you're on your plan from last year. You may see a little bit of a rate hike, but the point it's making is that there's other plans that are coming out, individual plans that you definitely want to go look at there, hence the premium decrease. So the popular plans, WellCare Classic, WellCare Value Script, Silver Script Choices, there are some price increases and there's price decreases. The stabilization comes partly, let's highlight this here, the stabilization comes partly from federal demonstration program that provides participating drug plans with monthly premium subsidies for up to $10 and caps monthly premium increases at $50. So this is all according to the KFF, which is the Kaiser Kaiser Family Foundation, nonprofit who's doing the studying. And so it lists out a bunch of drug plans. But the bad news, there's always bad news, fewer plans. And Selina, back to what you were saying too, non-commissionable plans. I don't do these drug plans myself, but I talked to my national broker today, and she said there's a lot of these plans now are non-commissionable. So people are on their own for the most part. And in 2026, there will be fewer Medicare Advantage prescription drug plans available, down 32 from 34, according to KFF, Kaiser Foundation. That's a drop from the peak of 36 plans. So Medicare Advantage insurers have been scaling back their drug plan offerings in response to changes in federal payments and unexpected increases in the use of health services that have led to rising costs and following profits. And I think that's important to understand, is that this is being driven in large part, this is very good to have, it's being driven in large part by what the federal government is giving subsidies for. So all this shifting that's going on right now really has to do with that fundamental of how much the federal government is subsidizing everything. This is why we're a big proponent of stabilizing things and moving more into original Medicare and in a supplement, a Medigap plan, if that's available, with a Part D plan. Any thoughts on that, on the good news of Part D plans, some Part D plans somewhere coming down in premium? But the flip side of it, more of them also are not allowing commissions or whatever, and so therefore people are going to be on their own to go figure out what they got to think. Any comments before we move on?
Yeah,
Nope,
Mark,
there-
I'd like to.
Go ahead, Selina.
Sorry.
Yep.
So I'd like to say I recognize every broker has a different position on the non-commissionable plans and not being the agent of record. So
Yeah.
it is important to recognize if you're not having a contract, you of course can't be agent of record. But I want to share that the nurse in me cannot look the other way. So the reason I got into this business is to make sure people could get affordable medications. So I still do drug reviews, and though I can't sign people up for most of the plans, I guide them on how to do it on Medicare.gov. So I also caution people that zero is not always your hero if you're taking brand drugs,
That's
because
right. That's right.
your copays and your deductible are going to be a lot higher when you are on a zero plan. And if you're taking Eliquis or Xarelto, it's best to work with a broker who can educate you on what's the most cost-effective plan for those high-cost drugs.
That's right. That's right. And just to add to your point, I'm a big advocate of going to Medicare.gov and looking down through there, and there's a little drop down that says total drug costs plus drug premium. It's the total combination of that's so important. Not the price of the card, it's the price of everything for that year.
And know that each pharmacy negotiates differently with the carriers, and so you can see significant cost difference among pharmacies. And I'd also like to share that it isn't just the carriers and not just us as members that are seeing the impact of the changes from the drug plans, but pharmacies. Those independent small town pharmacies, they're being hit hard too. And you may go to the pharmacy in January and recognize that they're no longer contracted with your plan. So most important, go through your new plans and make sure that your pharmacy is contracted. And do not rely on Medicare.gov to give you up-to-date information. Call your pharmacy.
Leith, you got something to add to that?
No, I just totally agree. Call your pharmacy.
Yep.
The Medicare.gov is helpful. It is
Right.
helpful. But again, to Selina's point, I just think it's so important that you have an agent to work with that knows the business and is not just captive with one insurance carrier, meaning that's all they work for. It's just in today's turmoil.
Yeah.
It's really important to find somebody that can work with you and sit down with them, that you get along with, that you respect, etc. And I think you'll just have a better outcome.
Right. Let's move on here. We want to move on real quickly here. We got some quick notes that we want to share. Again, this is just some of this is just flat out recap that we want to put through. So folks, October 15th through December 7th, this is where you're planning for next year, 2026, right around the corner. And we talked about Medicare Advantage plans and Part D plans are starting to scale back. We see there's rising costs and shrinking plan choices. There's a lot of disruption in the marketplace. We also believe original Medicare A and B, that is a foundation of coverage to make sure that you understand. And this is why we're going to go over a Medicare 101 here in just a second. But for 2026, be aware that if you're on straight Medicare, and Selina, I want to talk for folks that I know in the rural areas, there's a lot of folks that are on straight Medicare A and B, right? There's a lot of folks. There's dangers to that. We have to know what the dangers are on that because of the fact that it is something that if you are in a situation where you need a cancer treatment or something like that, you may not get it because Medicare A and Medicare B, if it's an outpatient treatment, I've had this happen before where Medicare B is your outpatient treatment and the Medicare Center says, what other coverage you got? Because Medicare is going to pay 80%. Who's going to pick up the 20? And an outpatient cancer treatment, they may deny the coverage if they choose to because they don't want to be on the hook for that 20%. So if you're on straight Medicare, be very cautious of this. This is what I want to speak to. Go ahead, Leith.
Yeah. I had a family member that ran into that same thing and they had a Med Advantage plan, but the doctor's office that they went into did not realize that. And when they walked up to the counter to check in for their chemotherapy, they asked them for $17,000.
That is exactly right. That's exactly right.
And if this person they just neglected to give them the information. But my point is, if they had just original Medicare Part A and B, they would have been on the hook for that money.
Exactly.
So it's really important to.
So out in the rural areas, Selina, as you're helping people in the rural areas, and I think there's a lot of people in rural areas that need to look at this cautionary thing of just having Medicare A and B only and realize the fact that they could be in a real pickle just with that straight Medicare.
Absolutely. And people are surprised that they can't just suddenly get a med supplement plan. They have to go through medical underwriting. And I can guarantee by the time they show up to my office, they usually have some disease or illness going on. And they find out that they've missed that opportunity to sign up without going through medical underwriting. So in addition to that Part B, you also risk the Part D penalty. So yes. I have these rugged farmers who they don't want to be told what to do. They don't take any medication when they turn 65. But most of them live until their 80s and 90s. And at that point, it's rare that we leave this world not taking something. So the penalties are non-forgiving. And so I say, please at least sign up for D, enroll, and this is where zero could be your hero just to keep you out of the compliance penalty phase.
That's right. Yeah, there's nothing like it, though, Selina. Have you helped people that have skipped that Part D coverage, taken any Part D for 10 years? And they go, why in the world am I being hit with $20 or $25 or $30 a month Medicare fee? Just a fee.
The last one I had last week, his penalty was $65 a month on top of his premium. He had a heart attack finally, and so he's having to take medications now the rest of his life. And he is so happy about that penalty in addition to his premium every month.
I know people don't like those surprises, but these are things and I also like to speak to adult children. Make sure you understand if you've got parents that are not looking after this, know the fact that there's these challenges for that. So getting back to the idea here is, and I also want to talk key cautions for 2026. Remember, timing's everything. So folks, if you are turning 65, make sure you understand that if you're not taking care of the options you have when you turn 65, you could get a Medicare supplement at that point, guarantee issue when you're turning 65, that window, don't miss that window. But if you have missed that window and you're past 65, this is where Leith, myself, Selina, we can help look at underwriting into a Medicare supplement plan. It's not evasive. It's worth looking at to really protect all your retirement savings and give those benefits. Go ahead, Selina.
I'd also like to add, for those of us that are still working at 65, you don't necessarily have to take the supplement or an Advantage plan. However, you do need to make sure that your employer provides what Medicare deems as, quote, credible drug coverage. So the insurance carrier providing your employer-sponsored drug coverage should give you a letter annually, and keep that letter, because when you do go on to your Part D plan, we need to prove to CMS that you've had credible coverage, or you can have a penalty.
Man, you're
But
go ahead.
the other thing is employers under 20 with under
Mhm.
20 employees, you have Medicare is your primary.
Correct. And
Yeah.
Leith, thanks for bringing that up, because I feel like those small employers don't have resources to gather that information. And I like to try to get that message out there. Again,
Yeah.
if you have fewer than 20 employers, you no longer carry that employee on your health plan. They have Medicare as primary.
Excellent.
Actually, I was reading up on this, and I'll have to check it, but I thought it said that you can still have employer coverage, but your Medicare is still primary if it's under 20 employees.
Correct. So it would be secondary. So I should have been
Right.
more clear. But
Yeah.
yeah.
Excellent. Well,
And a lot of people don't know that. And I was reading this article. The reason it came up, I was reading this article, and it was like this person was left out there with a lot of expense because they hadn't signed up for Medicare, and because they thought that their employer's coverage would handle it, but the employer came in secondary. And so Medicare, they were still asking for their money.
True story. And one other incident that I ran into is there's been someone who's purchased an independent ACA plan. They're 65 and they slip through the cracks. They're still paying for the ACA premium and they're Medicare eligible. That's also a penalty risk, because you
Right.
cannot have subsidized.
wow. We're
Yeah.
getting into the weeds. Getting in the weeds.
We're getting into the weeds.
All the good stuff. And then lastly, whoopsie, we don't want that one. We want this one right here. Is we talked about our shrinking Part D options, fewer carriers, tighter formularies that are going on as well. Hey, so let's talk about the prescription drug stuff though. But this is a new thing, $2,100 max out of pocket begins 2026. Is this a big deal or what to have that drug thing capped out?
It's better than it
Well,
was.
it's great for consumers directly. However, the insurance companies, for their bottom line, it's not great. And so I feel like that is one of the catalysts for causing fewer drugs that are on the
Oh,
formulary. So in our area, I have clients that are on Humira. That's a common high-cost drug to treat autoimmune disease. There is not one plan in our area that covers Humira.
wow.
So there is one other alternate, but that's a personal decision that a physician and patient make on what is the best treatment. And I think it's alarming that we're having that significant of a change. That's going to impact a lot of people's life.
Wow. All right, let's, Selina, we're going to do something real quickly here where we're going to build the house of healthcare. So everybody I love to make things easy. So here's the house. We've talked about Part A, folks. That's your inpatient stuff. And Selina, you had told me some weeks ago about Part A. Is there anything special you want to say about hospitalization as a former nurse or even a current nurse? Is there something you want to say about Part A that's special to you as you've helped people along the way?
I think one of the most surprising pieces of Part A, yeah, it's great because it's free for most of us that have lived and worked in the US for 10 years.
Yeah.
But there is that Part A deductible that happens every 60 days. It's not a one time a year calendar deductible. And it's over $1,600 this year. So if
Wow.
you break your hip, you go in the hospital and you go back 3 months later, 3 months and 2 weeks afterwards, you're going to have to pay that $1,600 deductible again, unless you have a supplement.
That's right. That's where our big thing is. Moving on here, we add another block to it. It's the Part B. That's your outpatient care. We want to make sure that you have the ability to have, remember Medicare is going to pay for 80% of that outpatient care, folks, but you're on the hook for 20% under original Medicare. And that's your doctors, it's your testings, it's your treatments, it's your therapies. One more T, testings, therapies, treatments, doctor visits. There you go. Labs, all that stuff. That's under outpatient. That's what everybody, when you're on Medicare, you're paying that premium, monthly premium to Medicare. It's probably coming out of your Social Security of, what is it, up to around $250 coming up or something like that. It's
supposed to be $206 in 2026.
Yeah,
and if you make a lot of money, there's a threshold. So the high earners if you're a high earner listener,
Yep.
you need to check because you're going to pay a lot more in that Medicare Part B premium.
Leith, you're opening up a can of worms. That's called IRMA, and it's a
I'm
big,
sorry.
it's a big deal though. But so your folks that are up in the Seattle area, the Portland area, that are high income, right? They're rolling out a household income. It could be 300,000, 400,000, 500,000 household income. Lots of people that are making that in the big metropolitan areas. That kind of income is going to drive an IRMA cost. That is a big
So,
play coming down the pike. Go ahead, Selina.
so I had a case where the husband decided that he wanted to buy a big RV. So he took out more of their out of the IRA account, and they got put in the IRMA threshold. So it's not just he that gets to pay the surcharge, but his wife, because they have joint tax. So 2 years later, that's how IRMA works. So the IRMA surcharge now is based on the taxes that we filed in 2023. So in January 26, it's going to be based on the 24 taxes. So since he had that large draw off of his individual retirement account, and they have the RV the wife didn't want, she's still mad because they're paying $600 a month in premium.
And
And
tell
they
me,
will for 12 months.
yeah,
I also work with clients whose maybe the spouse has died and their income brackets have changed. So I can help direct them on an appeal for that. Also, maybe farmers and ranchers who've had some crop loss, we can also do an appeal on that.
got it. That's good. That's good stuff. They still have the RV. They don't like the RV. Some of these people buy an RV and they're out of it in 12 or 24 months.
Yeah, but they aren't out of that IRMA surcharge.
Dude, Irma's still there. Irma's still there. Let's keep rolling here. We have the Part B we talked about, and then we add a Part D to it, right? We've been talking about this through the program. Notice before we go further, I'm going to hit this right here. There's a Medicare Supplement Plan. We are big advocates of Medicare Supplement Plans. It's big to be in control. They may be a little bit more a month, but there's ways to get it affordable. That's where individual conversations happen so that you can make it affordable. But it's going to cover all those gaps that Part B is leaving you with, and certainly those Part A. Selina talked about the Part A hospital deductible when you come in, and also copays. That if you're in a skilled nursing from days 21 through 100, there's copays. We want to make sure and fill that gap. That's the Medicare supplement. Notice on the drawing, I'm not going any further, but every good house must have a foundation. And the foundation here, there's custodial care. In custodial care, those expenses will be paid for from your savings. That's your care at home, care in a facility. Medicare does not pay for the custodial care. So it's very important to understand. That's another conversation. And I know, Selina, you want to talk more about that another time. We want to talk about that, don't we? In Eastern Oregon, in Washington, we want to talk about custodial care for our rural folks, right?
Yes, it's a big surprise that Medicare doesn't cover that.
It doesn't cover it.
They'll cover the first 100 days.
That's skilled care. That's skilled care, not custodial
Right.
care.
Oh.
Make sure, and this is a good thing to know, on custodial care, make sure that if you're in a skilled nursing facility and they find out that you are not getting better, you're going to be exited out of the skilled nursing. They say you now need custodial care, and that's not what we do here. We don't do custodial care. So it's very keen to understand that.
And know that the nursing homes have to prove that you require skilled care. And skilled care means like a nurse must change your wound care. They must provide IV therapy, or a therapist is doing a skilled therapy plan. And if you choose to not engage in that, then that's not skilled, and you get to go home early. You don't get the full
You don't get the full fun, all the fun jello and all that. Yeah. Yeah.
Medicare says the health is not going to cover that. You get to go home.
Get to go home. Good. We're going to bring the ship down we're going to start bringing it down a little bit. It's good to see everybody today talking about some of the basics of Medicare. Is there anything else, by the way, before we jump, anything else we want to chew on before we jump out of here?
Definitely find a broker to help you review your medication plans this year. It is so important, unless January is not going to be a pleasant surprise.
That's right. And to that point, Selina, and you're going to send me your calendar link, right? We're going to put your calendar link down below. Leith's calendar link is down below as well. want to make sure that everybody has access. If you want to talk to Selina, you want to talk to Leith, is jump on the calendar, and calendar is where it is because schedules are busy right now, and learn how to jump on a calendar to talk with Leith or Selina as well. And yeah, and as you told me, Selina, you're driving all over right now while the weather's good, right?
Yeah, so my clients that live far away across the mountain pass, I'm trying to get those guys all finished before the snow hits.
That's right. You don't want to be out there trying to pick up those last things because everything's going electronic too. And so a lot of people are not electronic. And so it's very good to make sure of that. Very good. Anything further, Leith?
Nope, not today. I
Not.
think we've covered quite a bit.
We've covered a lot of ground. Yeah. So anyway, yeah, we'll go ahead and wrap up here. Good to have you with us, Selina. I will say, make sure and understand you like and subscribe us over there on Facebook and YouTube. If you're watching this right now, that's where we're probably sitting, on Facebook or YouTube. Subscribe. And Leith, you can also say this as well, is we're looking at stats. We're looking at this and say, please like the channel.
Please the channel so we can stay on.
We're watching the channel grow, and the more likes we have, if you want to share it as well. So we're 9 a.m.s on Monday mornings. If you're over in the Idaho or the Mountain Time Zone, 10 a.m. as well. In addition to that, we also are big about the having Monday mornings, having a coffee hour, right? Don't trust your gals down at the salon. Don't trust the guys down at McDonald's, or you're all hacking out there with the horses, right, Leith? That's trust right. it. You don't trust it. Come on into the Zoom. You can see the registration, tt65officehour.com. Come on in. We'll be there for about a half hour. We'll talk to people Monday mornings following the live show at 10 a.m. and also 11 a.m. over in the mountains area. So right on Zoom. Yeah, Zoom. So it's real easy, tt65hour.com. So, well, thank you again so much, Selina, for being with us today. And it's been a pleasure. I've enjoyed it. We're going to do it again. We're going to do long-term care, short-term care on our next episode, aren't we?
Yes. Happy Monday.
Happy Monday. Yeah. Happy Monday. All right. Okay, everybody. We'll see you on the next time. And make sure you look them up because it's a real thing out there. It's a crazy world. So we'll see you next time. Ping us in the chat. See us over on Zoom. We'll see ya.
Friends, we've reached the end of our 30-minute journey on Talking Turning 65. I hope today's conversation shed light on the challenges and opportunities you face as a rural retiree in the West. See how our Social Security income can be maximized. We know the struggles to create lifetime income. Seek to plan for tax-free income. Build Medicare planning that is affordable. Learn about long-term care planning that doesn't drain the savings accounts when a crisis happens. Have our wills and trusts current so our family has our desires and not have the state make decisions. If you found value in today's show, please hit like, subscribe to our channel, and share this program with a neighbor or friend. Together, we'll keep the conversation honest and helpful for years to come. Thanks for tuning in, and we'll see you next time on Talking Turning 65.